Hello, everybody. Welcome back to the Incubator Podcast at Hot Topics in Neonatology. We are joined by a repeat guest on the podcast, Dr. Ola Didrik Saugstad from the University of Oslo in Norway. Ola, thank you so much for coming by.
Thank you for inviting me.
It's always our pleasure. You have a very interesting session at Hot Topics, and I guess it's going to be a very short interview because the question you're raising is what is the optimal initial FiO2? So you can just give us a number and
That's
your
right.
way.
Yeah, that's all we want to need to know.
Well, I wish I could. I mean, and that is, I think this is really some of the challenging questions in contemporary neonatology. We don't know the final answer. And now we're talking about immature babies in the delivery room.
Yeah.
Or very low birth weight infants. So this is what I'm going to discuss. Should we start low and titrate up? Should we start high or titrate down? And well, I end my lecture with some recommendations, but I underline that it's not evidence-based because we don't really know what is the optimal initial FiO2 for, let's say, babies less than 28 weeks who need positive pressure ventilation in the delivery room. As you know, the present guidelines say between 21 and 30% oxygen. But there are some new studies, and our own study, the net motion study, which was published in August, indicate that we need higher FiO2.
Yeah, we were just talking about that study with Vishal that was published in JAMA Pediatrics,
yes.
I believe.
Yeah. And but I don't think we know the final answer because I think that if we start with 90 to 100% oxygen, it's too high. And we don't have good data where we're comparing, for instance, 40% versus 60% or and now there are some studies coming out comparing 30% versus 60%. And one paper came out just last week from India, and it's not conclusive, really. So I thought that we would get a better answer to this question in the near future, but now I'm a little bit more pessimistic. I
was going to leave that question for last, but for now, can you give us some of the recommendations you'll try to leave the audience with?
You are the foremost expert on oxygen therapy, so we may as well listen to your recommendations.
Dr. Saugstad recommendations consult.
Yeah. Well, what I end my lecture with some suggestions, but I underline that it's not evidence-based. But I think that 21 or 30% oxygen. Well, now we're talking about immature babies, and it's too low. We should start higher. So I suggest 40 to 60%. But I've been thinking about. I think emotionally, I feel I will go for 40% more than 60%. But we don't have data on this. So
my question to you is: do you fear that we will, in the current scientific tools that we have, can we ever find the answer?
Well, probably not in my lifetime.
Oh, no!
So that's a little bit disappointing. But what I think is important to underline is that maybe as important as which initial FiO2, which FiO2 you start with, is how you titrate. And I will show you data tomorrow showing that two different cohorts were analyzed, and there's one from the Netherlands and one from Julia Owi's cohort. And although they start with the same initial FiO2, for instance, 30% oxygen, the same gestation ages, the Netherlands cohort, the saturation are much slower. And it takes 4 or 5 minutes until they pick up and are similar to the data from Julia Owi's cohort. So I think that is very important.
That time is not negligible.
No, absolutely. 4 or 5 minutes is because we know that what's happening the first minutes, first 10 minutes is crucial.
Yeah.
And as Vishal Kapadia has shown, I don't know if you talked about that, but it's also important to avoid bradycardia. So the combination of prolonged bradycardia, which is a heart rate less than 100 beats per minute for 2 minutes or more, combined with not reaching a saturation of 80% within 5 minutes, it increases risk of mortality 18-fold. Odds ratio
18-fold.
18-fold.
It's hard to argue with that.
So that's quite dramatic. And of course, we don't know what is the cause there. There's an association, but anyway, for that reason, we now recommend to avoid bradycardia and to reach a saturation of 80% or more within 5 minutes.
Okay.
So this will be one of my main messages tomorrow.
Love that.
Very impressive. Yeah. Dr. Saugstad, thank you so much for dropping by. And we will be looking out for your session tomorrow, and we'll try to link some of the papers you mentioned. And I think the trials you were talking about are the similar trials Vishal was talking about, the torpedo and the high-low trial.
Exactly.
Right?
Exactly.
Very good.
Exactly.
So people can look out for that.
Yeah.
Thank you so much.
Thank you
so much.
Thank you.